Well, joining us now is former NHS Trust Chair, Martin Gower. Martin, great to have you on the programme. I mean, what is going on here? Yes, we can point the finger at the pandemic and how that has hugely extended waiting lists. Yes, we can point the finger at the junior doctors being on strike. But the problems in the NHS have been going on for a very, very long time. What's the solution?
Well, I think the solution is that the system nationally doesn't work. But if we look at the issues that have been raised, the shortage of staff has been mentioned by people who responded to the survey. It takes too long to get a GP or hospital appointment. That has been also raised as a major issue. And I think it's not everywhere. I heard you earlier saying, you know, who are the 27% who are happy with the NHS? Well, I'm in one of them, actually, purely by luck, because where I live, we have excellent services, and I can't say otherwise, both in the terms of response times with the GPs, acute hospital, etc. However, the culture generally in the NHS is awful. And why do people not work effectively in any organisation? It can be to do with money, of course, but more often than not, it's just not a very nice place to work. And I think we've got that cultural issue. We've also, and I think this is true of a lot of the public sector at the moment, there is a lack of concentrated focus on what needs to be done. And I use the word focus because the peripheral things, the things that are kind of nice to do, it's good. You know, a lot of corporations are doing it, a bit of virtue signaling, etc., etc. I think those things really need to be quite parked in the NHS at the moment. Finally, I think the other issue, which we will always have, and it's not been great in my very, very long lifetime, is that it's run kind of by politicians who don't hang around very long. I think we've had 38 secretaries of state or health ministers since the NHS was founded in 1948. They come, they go, some are good, some are poor, some are a bit complacent, some do a reasonably good job. But to have them run the NHS run by politicians, we're just seeing what's wrong. I don't think it made much difference, whoever was in power, to be honest.
I was going to say, Martin, I mean, government after government, health secretary after health secretary vow to sort the NHS out, we'll reorganise it, we'll reshuffle it from root and branch, reshuffle, all this stuff, work out how we spend the money. West Streeting, the potential next health secretary for Labour, is actually making noises saying, you know, we shouldn't have so many sacred cows. There may be areas we should privatise, etc. So of all parties, it's Labour who seem to be accepting maybe a change of direction is in order. But I mean, this is the problem, isn't it? That politicians, they think it's good for their careers, it's good for their parties to call the NHS amazing, to tell that barefaced lie that the NHS is the envy of the world. And unless we can get rid of that attitude, unless we can get government in or a health secretary in who wants to be realistic and say the problem with the NHS is not enough money, the problem with the NHS is how it spends that money.
Kevin, it's definitely not that haven't got enough money. They've got more money. You know, we're spending 11.6% of GDP at the moment. We're up there with all the major European health systems. But let's not forget, there is, whether it's Wes Streeting, Jeremy Hunt, whoever else is there, the NHS management have a wonderful way of diluting things. In other words, the plan is to do this, this, and this, and they do a bit of it, enough to sort of keep everybody off their backs. But actually, what they don't really do is do it in a really radical way. And that's been one of the problems. It's fine for a health secretary saying, oh, we're going to do this, we're going to do that, we're going to change this, change that. Actually, bear in mind, the NHS is the fourth largest employer in the world. I think they're sandwiched between Walmart globally and Amazon globally. And the ones above them are the Indian Army, the Chinese Army, and the American Defense. So it's a massive, massive organization. And that's really what the problem is with it, actually. it's very easy for people to say, well, health secretaries, they come and go. I wonder who'll be next. Let's run a book on it. And I'm actually told not that the health secretaries who are appointed see it as a great opportunity, but actually when the Prime Minister is forming his cabinet, I've been told some years back by a cabinet minister that they dreaded that the appointment they might be asked to do was the health secretary's job, that it was basically a poison chalice.
See where they're coming from, can't you?
Most of the jobs these days are a poison chalice.
How about this, Martin? Right off the bat, I believe there are 3,500 unmedically qualified middle managers at the NHS on £100,000 or more. The NHS needs, in my view, as a matter of urgency, to look into what each and every one of these people are actually doing for this money. And while we're at it, let's see how much the NHS is spending on diversity, how much it is spending on literature, which excludes the word woman. We'll call them people with cervixes, etc., etc. The waste of money is off the scale, and that's what needs to be addressed very, very quickly. Would you agree?
I agree. This is what I was talking about, the peripherals. So these are things that are not core to their mission at the moment, is to get the waiting list down, concentrate entirely on patient care, and of course avoiding the necessity for people to come into hospital where possible. Here's a couple of things from me. £10 a visit to go to the GP. The GPs will tell you how stressed out and overworked they are, but they'll also tell you that 40% of the people in their waiting rooms needn't be seeing a GP. But if that is the case, then there's a job that this one job the government does have to do, is to educate people that actually there may be other solutions to their health challenges than I'm going to see the doctor, as I had to learn when I lived in America. When I tried to make an appointment with the doctor when I had a bad back, I was told, no, you don't need to see a doctor. You need to see one of our physical therapists, which was what happened to me. But, there's an educational job to do. £10 to go and see a GP. I bet that will take the waiting list at GPs down.
Yeah. Are you sort of suggesting that the model we have in the UK, because I'm glad you said this, because having lived in Belgium for a number of years, what you're suggesting is what happens in Belgium. If you want to go for a cardiograph, you go to the cardiologist. If you have a problem with your back, you go to the physiotherapist, you go to the osteopath. You don't need to go to the GP first. But in the UK system, everything filters through general practitioners. Do you think it's time we looked at that model and said, this isn't working?
It doesn't work. It doesn't work. I mean, I have grandchildren who live in America. When they're not well, they see a community pediatrician. They don't go to a place where there are everybody from very, very elderly grandparents through to tiny babies, all in this sort of waiting room place, waiting to see the doctor. That you go quickly to a specialist. I know that in France, where I had a home at one time, patients were referred from their primary care service straight in to see a consultant, get some scans done the same day. And I heard of somebody who actually who'd been in pain with his hip, actually got his hip replacement done that week. But there was no sending all these letters out and saying, would you please come to report to the outpatients at this time, when actually they hadn't even checked if you were going to be on holiday or away or couldn't do it that day. There's a whole lot of things there that just don't work. It's not that changed enough. Yeah. And the government, no government will change it. The only way they will change it is by allowing local services to work together to change it. Yeah. And I think that is a bit of what I'm seeing locally where I live. I'm very, very lucky, but I think there is a little bit more of that needs to happen. It's not about saying we will do this. It's about saying you sort it. There's no such thing as being nationally ill, is there? Yeah. No. It's a local issue, and we all judge the NHS by the services we receive in the local area where we live.
Yeah, GPs, just open your doors, let patients get to you. We've got to spare a thought for these local doctors. They're paying for those force fields to keep patients away from their surgeries is very expensive. Martin, great to talk to you as always. Thank you so much for your time.